best thing in the world. It's as simple as that. There is no better thing in the world better than the TT races. The feeling of freedom when you're riding the motorcycle on the TT course, the speed, the bumps. It is the best racetrack in the world to ride and race your bike on. I've won 4 races around the TT course in my career, and I've crashed in 4 as well, so it's a one-on-one average, you know what I mean?
We're on board with Milky Quail, and you can see there a bit of a fly problem. It's very, very tricky around the Isle of Man. Oh, and he brushed the ball! Oh, Milky Quail is down! Milky Quail is down!
Providing medical cover here at the TT races in the Isle of Man is a very unique challenge. Firstly, because of the sheer geography of the course. It's over 37 miles long, which means there'll be 80, maybe 90 riders out on the circuit at any one time, and we have to be able to cater for all of them at any point. But also the medicine is very complex. We have to provide medicine that's very high level, just as you get in the civilian world. But also the riders and their families and the spectators represent other medical problems, and they come over here in big numbers. Over 30,000 spectators come with all the usual sort of medical problems. So the medicine that's provided is also very broad. The course is in fact normal roads when we're not racing, and represents a real challenge to get medical care to patients. To accomplish that, we have a team that is all volunteers. It's quite a complex team. Approximately 40 paramedics and docs will be scattered around the course at key vantage points. We also have 3 helicopters that serve the racing, 2 dedicated for the racing and 1 that's there for civilian accidents that might occur. And we have a series of response cars to cover certain areas of the track. But outside the doctors and paramedics at the track side, we also have a team of physiotherapists that look after the riders, and we also have a pharmacist that helps cater for them and their families in the paddock. During a race, we also have a team in the race control room, and it's really important that the doctor or the paramedic works closely with the fire service, the ambulance service and the police service, and as soon as an incident is identified, they can activate one of the helicopters or one of the response cars and send them to the incident, and hopefully there'll be a trackside medic nearby that will be working with the marshals, tending for that fallen rider in the first few minutes before we actually get there. The really serious patients are put in the helicopter and they're moved here to the helipad at Nobles Hospital, where they're met by the HOG ambulance team, and they're transferred into the resuscitation area at Nobles Hospital, where if need be we can have a trauma team standing by, and if we feel the patient has problems with bleeding, we can organise for blood products to be there as soon as we arrive.
You don't ever think that you're going to crash, you don't ever want to think you're going to crash, but obviously when accidents do happen, you know that you've got the best staff there that will help you out when you do crash to get you out of your problems.
Belagari on scene now, Doctor.
Training is really important to us. We have teams that are coming from all over the world, from different backgrounds, so we really believe in simulation and doing moulages. So before every shift we'll make best use of our mannequins, and we'll set up little scenarios pretending there's a rider down, so that all of the team can get used to the equipment and practice the complex procedures like rapid sequence intubation and putting patients to sleep, or doing surgical techniques. We practice those every day.
Yes, I fixed the bougie, you pass the tube. Fluids are running, is he responding to the fluids?
Working over here at the TT is slightly addictive, I think, because we have lots of paramedics and docs and nurses that come over here year on year and year, and some people have been working here for decades and decades.
I've always been tempted to come to the Isle of Man TT as a spectator anyway, and then whenever the opportunity became available to come over and work as a paramedic at the Isle of Man races, and I had known some colleagues who had come over and done it as well. It just didn't take much more persuasion. As much as it is a very serious professional organisation to be involved with delivering high-end medical care, it's also very relaxed and sociable. To come over, you know, you're not just doing a service provision, you're actually taking stuff away from it and progressing your own personal development.
I think if you're interested in pre-hospital medicine, and you obviously like motorsport as well. This is a really unique place to come, providing such complex medical care in a challenging environment, and it's something I think we're all really proud of, and certainly at a personal level I'm really proud to be part of this team. And if anyone wants to join us, they just need to get in touch with us via the website.